Whenever I think of hospitals, I think of, there was this student that asked Margaret Mead, who's a famous anthropologist, the first sign of a civilized society. And normally people would think, well, is it tools or pottery or what have you? And she said, no, it was the remains of a human, probably 15,000 years old, who had broken their femur and it was healed. Her case was, a broken femur without medicine or anything would probably take about 6 weeks to heal. And in the animal kingdom, if you break a leg, you die. This was someone that showed a sign of someone else had to stay with that person, had to care for that person, had to feed and give water to that person for them to be able to heal like that. That first sign of compassion is the first sign of a civilized society.
The earliest calls for a hospital in Decatur County began in 1914, as the appreciation and need grew for more structured healthcare in rural communities. By 1919, 3 specific factors would lead to the answering of those calls. The First World War had finally concluded. The violence and atrocities of the Great War had given Americans a newfound respect for what hospitals could achieve. Second, the Spanish flu pandemic was ravaging the country, again showcasing the value of formalized healthcare practices to the growing populations. Finally, and even closer to home, was the rising infant mortality rate in rural areas including Decatur County, where many births were taking place at home with inadequate access to proper health care.
In the case of Decatur County, the ag community actually stepped up and said, listen, we need this. It's special to hear some of the names of the people who were behind the push to get the hospital. I mean, the families are still here, the Shirks, the Stewarts, those kind of strong ag families are still here, taking part in the community, and they pushed to get the hospital approved in 1919, and it started breaking ground in 1921.
In February of 1922, Decatur County Memorial Hospital officially opened its doors. The state-of-the-art hospital included 3 floors, 25 beds, a superintendent's quarters, an X-ray machine, and even a working electric elevator. 2 days after its opening, the hospital saw its first patient, Miss Retta Griffin from Kingston. 3 days later, the first operation was performed, a tonsillectomy. The hospital was paid for by a $100,000 bond, with an additional $5,000 raised by the community itself. These funds were raised by local churches, Sunday schools, sororities, and individuals. In fact, grassroots efforts and community support would be a common thread weaved throughout all of Decatur County Memorial Hospital's history.
It's a recognized importance to any community, to society as a whole, to take care of one another. And continuously, you're right, throughout the entire history of DCMH, the community has stepped up and said, we believe in this institution, we believe in this building, and we're going to invest our time, our money, and in its future.
The community is behind the hospital. If there's a fundraiser, they're there to help, and because we want things to be close by. We want things to be close by.
It was exciting all around because this was a huge investment in our community, one of the rural state-of-the-art facilities in our community, and it was built by our community for our community.
By 1930, the hospital was seeing 402 patients and 34 births in a single year. By the end of the decade, those numbers would be doubled. While the Great Depression had large impacts on hospitals, healthcare didn't stop, fueled by community-supported hospitals like Decatur County. Under Franklin Roosevelt's New Deal initiative, the hospital utilized funds from the Public Works Administration to expand in 1939. By 1941, the hospital included 45 beds, a 3-room X-ray department, an in-house laboratory, and an additional elevator. The outbreak of the Second World War again placed a burden on the healthcare system. But by war's end, the nation was again focused on healthcare as the next battleground. By 1949, Decatur County Memorial Hospital had an annual admission rate of 1,710 patients. By the dawn of the 1950s, a new pandemic would consume both the nation and the Decatur County community.
In the 1950s, the U.S. experienced one of the worst polio outbreaks ever, specifically in 1952. When the vaccine did come out in 1955, DCMH was at the forefront of helping disperse those vaccines here in our community to help rid the world of polio, which also by that time it's actually affecting more children than ever before. And that's where it really struck a nerve, I think, in the nation. It did stress the I guess, role that DCMH plays in the community, in public health.
New technology and new advancements were being pioneered at the hospital, and a new focus on the patient-provider relationship was just around the corner.
Hospitals are nurses. Nurses are hospitals. To say that they're essential not only for the care they give, but also the empathy and the understanding that they have, not only of the patient, but also the patient's families. Remember, it's not just about the patient, it's about the patient's families. And in 1950, I think, is when they started putting in the kitchen and the cafeteria and the waiting room. It became more of a health center, and the nurses were a huge part of that.
It was the early 60s because I just graduated as an RN from Ball State. So that was my very first job. We had our own RN club, and we met here in the hospital in the basement. The nurses, I can't say enough good things about them, of course. I think they went above and beyond.
The nurses ran the hospital, and they ran it well. You would have a doctor that would come in to help advise accordingly, but the day-to-day, be it finances, the day-to-day management, the day-to-day care, that was all nurses.
Back then, I can't even tell you what my wages were. I didn't care. I just wanted to be a nurse.
I came here in October 1980, and I always did enjoy helping people. I enjoyed nursing from the very beginning. So really, I'm 91 now, and I've been a nurse since I was 18, so thank you for the opportunity.
Expansion continued throughout the second half of the 20th century, including the implementation of a home health care program, outpatient surgeries, and an oncology program.
Particularly in the 60s and on, I think that's where you got a lot. There was a tremendous advancement in technology, and you were able to bring some of those services that you had to ship patients out, or they had to go elsewhere. They could get them right here. It wasn't really until the 80s that really the specialization started coming in. I think that's when the oncology wing came in. It was late 70s when the EMS department was established here.
In 1995, the hospital saw its biggest expansion project yet, including upgrades to the registration area, the emergency room, and surgery suite on the second floor. Cutting-edge technology and state-of-the-art services were catching the attention of physicians throughout the state, bringing new, highly skilled specialists to the hospital.
With our expansion, we've attracted the doctors. Even as a volunteer, I've seen people from other communities come to our hospital because with the expansion, we've attracted the specialists. And people don't have to drive into the city to see a specialist.
By the beginning of the 21st century, Decatur County Memorial Hospital was becoming more than just a hospital. By expanding into the community with family medicine offices, including the purchasing of the multi-medical specialty clinic on North Michigan Avenue, and moving providers into the Wellage building located adjacent to the hospital. These additions allowed more access to primary care providers and space for visiting specialists and physicians. In addition, the outpatient services within the hospital grew, allowing more patient procedures to be performed on an outpatient basis without the requirement of lengthy hospital stays. By 2012, these outpatient procedures accounted for nearly 80% of the hospital's surgery services. In 2013, DCMH launched its most ambitious expansion project yet, with a 2-story vertical expansion above the existing hospital. The new addition included a med-surg unit containing 22 private patient rooms, an advanced care unit, and an open-concept floor plan with a family waiting area and main nurses station. By 2014, the hospital had become ISO certified. To this day, Decatur County Memorial Hospital remains the only ISO certified hospital in the state of Indiana. The 4th floor cancer center opened in 2016, allowing for cancer treatments and infusion services. In 2020, Decatur County became one of the first hardest-hit counties in the state by the coronavirus pandemic. As the community was left searching for answers, Decatur County Memorial Hospital was at the forefront of testing and treatment, becoming one of the first rural health organizations in the area to offer COVID vaccinations. Additionally, DCMH participated in advanced trials of monoclonal infusions and convalescent plasma. During the pandemic, the hospital also began offering telehealth, or virtual care visits, allowing patients to see their providers from the comfort of their own homes. Past, present, and future, Decatur County Memorial Hospital had truly become a leader in public health.
We're very proud at DCMH that we were recently ranked a 5-star hospital, which is in the top 15% in the nation, and one of only 13 hospitals in the state, actually, in the top 7% in the state. It's something that we're very proud of, it's something that's well deserved, and something that we're going to strive for in all the years to come.